Welcome back. So let's get started on our program by introducing our first keynote speaker. He'll be looking at the progress, lessons, and future for healthcare. Now we're a quarter of a century into the way into the 21st century. Please welcome from Evercore Partners, François Maison-Rouge.
Thank you. So thank you for the introduction. I'm very glad to be here today. Hello, everyone. I do wish you a really great conference. I'm François Maison-Rouge. I lead the healthcare franchise at Evercore, the independent investment bank, with about 120 people and teams in New York, London, and San Francisco. We in the healthcare group stand in the top 5 actors in this space. Nul n'est prophète en son pays. Of all the big countries, France is probably the one where I've done the fewest deals. Last week, however, we announced the formation of our French team. After 29 years of existence, we finally have a Paris office. It's being run by our 3 leaders, Charles-Henri Philippi, Andrea Bozzi, and Charles Andrés. Hopefully, that will help with our market share in France. Today, the topic I'm addressing is lessons from the first quarter of the 21st century and what we can expect in the next quarter. There's been tremendous scientific progress in the past 25 years and tremendous progress in the delivery of care as well. There's a saying in the US that goes something like, "What's the difference between healthcare and Starbucks?" Well, Starbucks managed to transform a commodity, coffee, into a special experience. And providers managed to transform a special experience, the bond between a patient and her doctor, into a commodity. It's a joke. Pay attention, please. But the reality is that there really has been progress, even if the experience isn't that great. So, what has fueled this progress? Since the turn of the century, life expectancy has increased tremendously. It's really hard to believe when we see what we're seeing. Obviously, in developed countries, the movement has not been that large, if at all. But improvements in access to food, water, basic medicines like anti-infectives and vaccines have been very positive. I'm the chair of the Pasteur Foundation, which is the US foundation that supports the Institut Pasteur, and I'm involved in the work that our more than 30 centers in Africa, Asia, and Latin America do to support public health. Now, in developed countries, we've seen some huge scientific discoveries that have led to health improvements. Checkpoint inhibitors for cancer, for instance, but also, and very importantly, the incretin class of drugs that is such an important solution for obesity and its comorbidities like cardiovascular disease. The gentleman from BioLead or one of my predecessors talked about the 5 billion invested in France in infrastructure. 2 billion of that is Novo investing in their plant in Chartres, by the way. So we have a very different supply chain these days. This is all underpinned, of course, by the advent of artificial intelligence. As we can see here, AI is bringing change and improvements to tasks we already do. Machine learning is helping us discover drugs faster. Deep learning is helping us analyze images, for example, the interpretation of scans. Natural language processing is helping us derive conclusions from massive amounts of literature. On that one, I'll point out that NLP doesn't exercise the judgment to weigh the input from this source versus that other source. My view, though, is that we need to take AI for what it's worth. Yes, AI can help get to answers quicker, but it's not going to be able to get to ask the right questions any quicker or any better. After all, AI stands for artificial intelligence, not artificial imagination, not artificial intuition. I'm saying that because I hope I have a future in life. I'm reminded of a remark that the head of technology at the Vatican told my late father in the early 60s. L'ordinatorio è la macchina la più stupida del mondo, ma che va veloce. Do you guys all understand Italian? So, in healthcare, we often look only at our world without putting it in the context of the general economy. So we did a little exercise. 20 years ago, the cumulative market cap of the top 10 healthcare companies added up to $1.1 trillion. And the cumulative market cap of the top 10 companies of any company added up to $2.4 trillion. Today, the cumulative market cap of the top 10 healthcare companies adds up to $4 trillion, while the cumulative market cap of the top 10 companies adds up to $18 trillion. So that means that if you're an investor, what you really ought to do is buy an index fund and buy a couple of tech companies, and that'll be okay. And we're all trying to progress science and to progress healthcare in an environment where it's really difficult to compete with other areas where people can have much better returns than we can. The relevance and investability of healthcare has declined dramatically, even if the percentage of healthcare in the GDP has increased. Somewhat, not dramatically, actually. Another observation is that today, 9 of the most valuable companies in the world are American, and 7 of the 10 companies are tech companies. There's only one healthcare company in the 10 most valuable companies in the world, and that's Lilly, at about $900 billion. I'm announcing that I'm going to retire when Lilly reaches $1 trillion. So I kind of like my job, so I really don't want them to grow that fast. We've just not seen healthcare companies bring that many step changes in the way we do things like tech companies have. And a throwaway comment that I can't resist making, United Health, with a market cap of $550 billion, really? I mean, United Health, what do they bring to the world? So some more statistics. That said, a lot of the goods and services provided by the tech companies end up being embedded in healthcare. So what I'm saying is not completely exact. Even if tech companies have been generally unsuccessful at entering the healthcare market other than B2B. They operate by following rules of logic and consumer free will that we all know do not exist in healthcare. Even more statistics. This displays the valuation of the top 25 venture-backed private companies. It's amazing to see that the first healthcare company in that list shows up in the 24th position. It's Village MD. It's basically a chain of dispensaries. Most of the other ones are tech companies. Given all that, and even if massive amounts of venture capital are devoted to healthcare, reaching $160 billion in 2021, which was the high watermark, the percentage of venture capital directed to healthcare is actually going down historically. It all makes sense. The gap between success in healthcare and tech is large. The gap between success in the US and elsewhere is larger still. If you look at the bottom, this represents the top 5 biotech companies in every country that is listed here. The line in the bottom is the US. It's $480 billion. It's much, much, much longer than that, right? But it's a broken line. It's about 13 times the market cap of the top 5 companies of the next most valuable biotech markets, which are China, Denmark, and the Netherlands. You can look at your own favorite country on there. If you're interested in numbers, there's very little R square, between the size of the population and the value of the biotech market. I'll let you think about the reasons. So, and I asked myself, what's going on that people actually aren't? And we had this discussion with Mark before the session started, right? What's the explanation of this gap? There's not a dearth of fundamental scientists in the in Europe, I'm sorry. In fact, well, actually they all go to the US, but in fact, Europe publishes about the same amount of articles as the US. If one looks at the most cited 1% publications, the US publishes twice as many articles. So if you were to extrapolate, you wouldn't think that, if the US publishes twice as much as Europe of meaningful papers, why is it that doesn't translate into a biotech industry or a healthcare industry in Europe that's half the size of the US, which it certainly is not? So what's going on there? I don't have all the answers, but I certainly want to pose the questions, and then we can ask AI to figure it out. But it's a proportion that's really worrisome. Another interesting statistic is that the EU doesn't spend that much less money on research, on government-funded research, than the US. But somehow that doesn't translate into companies in the same proportion, not at all. So while Europe does spend almost as much money as the US in government-funded research, the venture capital transforming this investment productively is much less. This chart shows how venture capital invested in Europe is about 1/3 of that invested in the US. And valuations of European venture-backed healthcare companies are at a discount to their US peers. Counterintuitively, at least for me, this differential has increased over time. I mean, I don't know if some of you remember in the 90s, there was this whole big, after the fall of the Berlin Wall, there was this whole effort in Europe to create an industry, the know your mark and all of that stuff, which has now gone by the wayside. So what we also see is an increase in the market share in Europe of biologicals sold by US-based companies, which is completely logical, right? So this is part of a vicious circle of European companies becoming less profitable. They also operate in a home market that is fragmented and cumbersome, even decades after the formation of the European Union. If I refer back to the recent report of Mario Draghi, his general conclusions and recommendations apply to healthcare. It's certainly not the case that Europeans can't get educated or can't get research grants, but there's a blockage to translate their ideas into real commercial enterprises. There's some that got away, like Argenx or Genmab. Argenx used the public markets to fund its very ambitious development. Genmab used its partners to do that. Their commonality is the ambition they had and the brute force of their development. We're talking, Mark, you said it also before, just the fact that you put more money into development, go things quicker, broader, which we don't do. Most European biotechs live hand to mouth. You heard it from Frédéric, in a vicious spiral. What we need is harmonization of end markets, more venture capital, and more people willing to fall flat on their face. In fact, there's something I regret in my own life, and that's my background, perhaps as having been educated in France. I was pretty well educated, but I always overestimated the risk of any situation and underestimated the reward. And because I was in a pretty cushy environment, I never had to take those risks. During COVID, my wife and I read a lot of things about society and kind of how things are different in different countries, society in the United States. We've seen only 3 times that I can remember. So, little anecdotes. Who's the father of venture capital? It's a guy called General Doriot, who's French, and who was at Harvard Business School. He was the guy who was in charge of the supply chain during World War II. Another little riddle, what was the rank of the U.S. Military power in 1939? Anybody has a guess? So in 1939, the U.S. was number 19 in military power. Just as a little fact, Portugal was number 18. I think France was number 1, by the way. In 1943, the U.S. was number 1. What did they do? They had General Doriot organizing the supply chain. They had this Danish genius called Knudsen, who basically organized the armaments industry with people, doing ammunition in their bathtubs. And they had Kaiser doing the boats, the Liberty boats. My wife and I were reading this thing because we tried to understand, warp speed and the US throwing tons of money and tons of resources without a lot of thinking about the equity and the fairness, et cetera, of it all, but just throwing as much money of it as possible. And, I was really amazed because the European Union was really thinking about access to vaccines and how they would, just make it right so that, this population got it, et cetera. And the US just went for it. And it's a completely different mindset. What happens is that there's tons of wasted money that happened, right? But there's also some of it actually stuck and went to the right place. So the great irony is that even though the US didn't have much of a manufacturing infrastructure for the pharmaceutical industry, because it all moved because of tax reasons to Ireland and Puerto Rico, they gave all sorts of money to people to actually go out and buy it, et cetera. And people did, and then now they're just swapping it and selling it to Lilly and Novo at great profit. So I love the fact that all of this industrial policy ends up in somebody's pocket most of the time, but also in somebody's arm in the form of vaccines also. So in any case, these are anecdotes. I'm not sure there's like super important lessons there, but it's certainly ways to think about. Sometimes it's just good to not overthink things. It's especially true of venture capitalists, by the way. Whenever a venture capitalist, when you do a pricing of a deal, thinks about offering at 12 versus 11, not being diluted, et cetera. I mean, that is the beginning of the end. You know that, right? So I'm sure you think I'm probably more knowledgeable about the markets and M&A than I'm capable of channeling Mario Draghi. But so I'll finish with some of what's going on, so what I've seen. So M&A in biopharma over the past 8 years has this shape. We've never seen such small deals in biopharma as we have this year. It's crazy to think that the biggest pure biotech deal done this year was $4.9 billion. That is worth half of 1% of the value of the leader of the industry. And when you think that, you know, the FTC is worried about consolidation in the pharmaceutical industry, it's completely risible. The massive LOEs we're going to experience in the next few years, as well as it has to be a more benign regulatory environment, should, in our view, restart larger deals. Once we're on the other side of US elections, which typically really freeze everybody, we should see that. And there's always, you know, kind of a supply of new companies to go after. I mean, Summit has a market cap today of $24 billion. It did not exist. I mean, nobody knew it existed 6 months ago. So what we've also seen, which is interesting, is that we've seen the advent of some regional smaller buyers wanting to access the US market, and a shift of VC backers interested in selling pre-IPO rather than dealing with the vagaries of the market. Talking about the small, mid-size, you know, the small and mid-size European companies, 20 years ago, I would have bet that they would have stopped existing, but they actually managed to continue to live, and they're actually doing quite well. So in the end, I do think that transactions will come back, but there's a pretty small reservoir of buyers out there, and they can each only do a max of 2 or 3 deals a year. It's just their capacity. So we'll see more bigger deals, consolidation, and I really hope a few Vertexes and Regenerons coming out of Europe. It's just not good enough to provide a lovely setting, Barcelona, to host ESMO. It's important to actually generate some of the more important papers. Thank you.